What is the most common cause of cancer-related mortality among Filipino women? Cervical cancer. Cervical cancer is the second most common malignancy worldwide. Out of 100,000 women, 22 are diagnosed yearly with cervical cancer. In the Philippines, we have more than 7,000 reported new cases each year, of which more than 50% are deaths. Of those diagnosed with the condition, only 44% live past 5 years from diagnosis, causing the death of 1 in every 10,000 women. Upon further studies, we can attribute this to the fact that 75% of cases are diagnosed when patients are already at the later stages of the disease. And thus, for early detection of cervical cancer, knowledge of the disease is important. The following are risk factors for cervical cancer: early sexual intercourse, low socioeconomic status, multiple children, multiple sexual partners, unprotected sex, and smoking. So what are the signs of having cervical cancer? Postmenopausal bleeding, unusual vaginal discharge, abnormal uterine bleeding, pain during sex, and lower back pain. Initial diagnostic testing includes VIA, pap smear, and HPV testing. So have yourself checked and go to your nearest gynecologist for evaluation and testing.
Seven in 100,000 women are diagnosed with cervical cancer each year. Mostly, they are those with multiple sexual partners and those whose partners have multiple sexual partners as well. Some can be asymptomatic, while some manifest with abnormal bleeding and pelvic or back pain. Fortunately, this can be prevented through pap smear, and vaccinations. So pay your gynecologist a visit as soon as possible. Take away the fear. Have yourself a smear. Don't let cervical cancer abridge those happy years.
Every person has a story to tell. Mine is that I have cervical cancer. I never thought it would happen to me. My sexual awakening began at 15 years old. But I was only intimate with one person ever since. I was and still am faithful and loyal to my husband. But my husband was with other women before me. At first, it was just nothing. It began with pain during sexual intercourse. And then I had unpleasant vaginal discharge. It was unusual for me too. It was then that I've learned that anyone is at risk. In recent studies, there had been overwhelming evidence that an infectious agent, particularly human papillomavirus that is transmitted through sexual intercourse, causes cancer of the cervix. In the Philippines, cervical cancer is the second leading cancer site among women. An estimated 7,277 new cases of, and 3,807 deaths due to, cervical cancer are expected to occur every year. The following had been established as possible causes of cervical cancer. Have had multiple sexual partners. Have had sexual partner who is infected with human papillomavirus. Had first sexual intercourse at a very early age, possibly 15 or 16 years old. Symptoms. Generally, cervix cancer do not have symptoms. Often, the disease is detected during its advanced stage. However, the following impressions often lead to cervix cancer. Unusual bleeding from the vagina at any time. Unpleasant vaginal discharge. Leg pain, urinary bladder symptoms. Early detection. Cervical cancer when detected early is curable. At present, the most reliable and practical way to diagnose early cervical cancer is through Pap smear. Treatment. Since there is almost universal acceptance that cervical cancer is primarily transmitted through sexual intercourse, the following preventive measures should be followed. Use of barrier contraceptives like condoms during sexual intercourse. HPV vaccine. Be informed. Be vigilant. See your OB-GYN today.
Have you ever been ghosted? Her name was Trisha. She was quite a stunner. She brought life to my boring world. She taught me things I never would have thought I would do on my own. She had a lot of experience. I wasn't her first. I wasn't even sure if I was her only one. But I still adored her. Her smile, her confidence, her energy. We were on and off for a year, and just when things were getting serious, she suddenly disappeared without a trace. She ignored the signs, the bleeding, the pain, and knew when it was already too late. Yes, I was ghosted, but it never would have happened if I helped her change, if I committed to be her only one, if I convinced her to have herself checked. If only I knew better, it would have been prevented. I lost my first love to cervical cancer. And I won't allow myself to lose my last love to it as well.
Meron ko ang cervical cancer kay isa na siya kasakit na makuhaan sa mga babae.
Na makuha na nimo sa sexually transmitted disease. Dili sa kita kailangan magpa-check up sa doktor para malikayan o kailangan magpapakuna.
Babae. Mahalaga ka.
This is me, and this is you. Each day we try our best to make our families happy. We try our best to get a promotion and earn more. We want to travel to places and do a lot of things. And so we work hours, we do chores, and we lengthen our days until we make it happen. Then suddenly, something comes up. Cervical cancer. It causes abnormal vaginal bleeding, fatigue, discharge, pain on sexual intercourse, and loss of appetite. What is cervical cancer? It is the second leading cause of female cancer in the Philippines. 12 women die each day. It is caused by human papillomavirus, affecting 8 out of 10 women in their lifetime. How did we get this? Risks are multiple sexual partners, giving birth at a young age, multiple pregnancies, smoking, and a family history of cervical cancer. We can prevent cervical cancer by getting screened, do annual pap smear, and get vaccinated with human papillomavirus vaccine and a healthy lifestyle. Join the fight against cervical cancer.